thing you don't want to get over the holidays is sick, but the flu and RSV are both spreading in the mid-state right now. Let's turn to Sarah Wilson in the studio. Sarah.
Alicia, this happens this time of year every year, so it's not unexpected, but doctors are especially worried because RSV cases among children are high and still haven't peaked. Week by week, a steady rise in sickness. The mid-state, a particular hotspot. Nearly 4,000 new flu cases across the state this week alone. COVID cases also on the rise. RSV climbing the fastest.
We've had very high levels of capacity.
UPMC infectious disease specialist Dr. John Goldman says his hospital is feeling the effects. Data from the Pennsylvania Department of Health confirming that, showing cases in the mid-state are high and mostly impacting young children.
It is resulted in a lot of pediatric hospitalizations, a lot of pediatric intensive care units.
Experts fear infections may only get worse as we head into Christmas.
It takes about 2 weeks to get full immunity, but if you get your RSV, COVID, or flu shot now, you will be near full immunity at the time you start to gather, and you will be at full immunity by the time you toast the new year.
The majority of adults and kids are eligible to get the flu and COVID vaccines. The same can't be said for RSV, which is short in supply.
We're trying to prioritize our most vulnerable, which are newborns and our premature babies.
The bottom line is, though, that all three are at fairly high levels. Flu and COVID are still increasing.
Which is why they're urging action now.
So it's just easier to prevent it rather than go through it.
If you infect someone who's young and healthy, it's going to inconvenience them. They might have to take a day or two off work. They might feel miserable. If you infect someone who's older, has more medical problems, you may end up having them land in the hospital and you may have them die.
Now, this is the first year the RSV vaccine is out, which is why doctors say there's likely a supply issue. That vaccine is recommended for infants younger than 8 months and anyone over the age of 60. Valerie?